Massachusetts Attorney General Maura Healey is with us in studio this morning. Let's go on the record. As AG, she's taken on Big Pharma and the policies of the former president. Now with Trump gone and the pandemic easing, what does the future hold for this progressive trailblazer? Let's go on the record.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Welcome to OTR on this Sunday morning. I'm Ed Harding along with News Center 5's political reporter Janet Wu. Big progress on the COVID-19 front. Mask regulations are loosening. 12 to 15-year-olds are getting vaccinated. And we do continue to observe social distancing protocols here in Studio C, as you can see. At the center desk this morning, socially distanced, is Attorney General Maura Healey. She has been the state's top law enforcement officer since 2015. We're pleased to have her with us here today. Thanks for joining us. Great to see you.
It's great to be with you both.
It's a wonderful Sunday morning. It's gorgeous. We are taking off our masks more than you were. You must be thrilled.
No, I am. I mean, it's great to see us at this point as a state, as a country. This has been such a difficult year for so many people. And, you know, I know that we're all looking forward to the chance to be together, to hang out together, barbecues, just all the things that we used to do that we haven't been able to do. And most importantly, I'm so glad to see the reduction in the number of infections and deaths in our state and around the country.
So among the things that we are planning, we can sort of plan our futures. You're doing the polling. You're talking to voters in different parts of the state. Are you ready to make a decision on running for governor next year?
No, I'm not. And I understand you asking this question. I'm going to leave it to the pundits and the speculators. I'll tell you, Janet, that I am focused on doing my job. We've got a lot of work to do as we come through this pandemic. I meet regularly with folks out there, and we still have folks who are facing issues related to how they're going to pay a mortgage, how they're going to pay rent, how they're going to get childcare. And I'm also really concerned about our small businesses in this state who are desperately trying to find people who will come back to work. And so I just think we've got a lot of things to work on and focus on. I'm also incredibly concerned about the opioid crisis.
Mm-hmm. But the thing is that you are paying to get a poll done, so you must be thinking about it. Is that fair to say?
Again, I'll leave that to others in the business to speculate on all of that. And you know what I'm going to continue to talk about is the work we need to do in the state and the work that I need to do as Attorney General.
So let's talk about Governor Baker. I'm quoting here. The president just said in the past week that Governor Baker is doing a hell of a job. He got those kudos from the president, from the head of the party, President Biden, on Baker's handling of the vaccination rollout. So let's talk about that. Do you agree that he's done a hell of a job with the vaccination rollout?
You know, I think that Governor Baker deserves credit for making corrections along the way. To be honest, I cheer for this state. I want the governor to do well on COVID. I've wanted that from the beginning, and I'm pleased to see where we've ended up. Yeah, there were some really bumpy aspects over the last year, and I think I made my voice quite clear about my concerns about the vaccine rollout, concerns about equity in the distribution of shots, concerns early on about some disorganization I saw around procurement of PPE and the like. That said, you know, along with others, I think it's been a team effort, and I credit to the healthcare providers who've stepped up in such big ways. We've got more work to do. We are not through this. As I mentioned, I think what now is ahead are really a lot of the economic issues related to this health pandemic. And so we're facing an economic pandemic that we've got to really grapple with and work with. And I'm hoping and really pleased to see support coming from the federal government through the American Rescue Plan that will hopefully go right to helping our families, our small businesses, and our communities move forward and thrive coming out of this.
But the rollout was bumpy. There's no question about that. But the adjustments have been good. You were mentioning teamwork. The adjustments that the team has made have been terrific.
I think this has been a team effort around the state. You know, I visited a ton of vaccination sites, healthcare providers. It's been amazing to see, you know, food pantries retool and be a place where you can go and get shots, or what our pharmacies have done. I think about all of our hospital systems that, you know, not only are supporting our community health centers, but also supporting these mobile units, these vans where people are literally going out into neighborhoods, into homes to make sure that our most vulnerable vulnerable, maybe homebound residents are getting what they need. And so, I just think it's been a tremendous testament to the resilience of people in this state. I've seen the way that, businesses have helped one another. I've seen the way that community has helped one another. And we've got to remember that we have that in us, right? We have that capability. And I hope we take that lesson, that measure of resilience and the spirit of actually working together to get things done, to now take us forward and think about all the great things that we can do and improve upon in this state.
Well, as we look forward, unlike Governor Baker, you're calling for mandatory vaccination for public employees. Is this all public employees or only those with direct contact with the public? And do you actually fire those who refuse to get the vaccine?
I put this out here as a general principle, and I think it's really common sense that those of us who are interacting regularly with the public as part of our jobs should really be required to do what is necessary to protect public health and public safety. We've worked so hard, right? And so many people have suffered. And so my hope through more education about the vaccine, I understand there's some hesitancy still, that more and more people will see fit to get themselves vaccinated. The sooner we're all vaccinated, the sooner we are back to business.
So are you saying that you would fire people if they did not get it, or you would not go that far?
Oh, absolutely. I'm not saying that. Again, my call, Janet, is for a recognition that this makes a lot of sense for people to be vaccinated in particular jobs, especially. And, I hope we just see more and more of that, and I'm going to continue to keep my eye on it. Of course, we want to wait until the federal government and the FDA, formally authorize what has been a temporary authorization of the vaccines. But, I think this is where we need to go.
Let's talk about police reform. Debate over it is raging all across the country and, of course, here at home. So does the state have a role in this? Does the state have a role in it, not just the communities, the cities? Or is reform needed, and does it start with the state police, which works closely with your office?
I think that the conversation around police reform has been difficult nationally, but it's important. And, there's been this moment, particularly here in Massachusetts. We just passed important comprehensive legislation. It's going to be up to folks on the local and state level to see that implemented. And it's going to be up to all stakeholders, members of the community, the faith leaders, civil rights activists, as well as law enforcement and police, to work together now to implement this important reform. You can do and have safe, secure communities and effective policing while also respecting the civil rights of others. And, for far too long, this has become an unnecessary, divisive debate. But as I talk to police chiefs and police officers, and as I talk to members of communities, what I see is more of a commonality than sometimes is presented. Out there. And I'm optimistic about what we can get done in this state. Yes, it has to happen at the federal level, but it's really important that community by community, we're taking this on and having this conversation and doing this work.
You've led on many national issues, most prominently by suing Purdue Pharma. It offered to settle for $4 billion, but wants to file bankruptcy and not release all their records. You have refused that offer. How much longer will this likely go on?
I can't tell you, but I can tell you that more people died in Massachusetts from opioids this past year, 2020, than ever before in history. And I understand it fell off the front pages during COVID, but I want to be clear with the people of Massachusetts. This is a serious issue. It's an issue that continues to ravage families, and I want you to know I'm going to do everything I can in my office to attack this. Yes, we sued Purdue. We sued the Sacklers. We're still fighting them in court. I recently secured $700 million from McKinsey and sued another company lately for their role in promoting opioids. We got to come at this with education, prevention, social services, big time we need to help people who are sick. And I'm going to continue to lead on this here in the state and certainly nationally.
So do you have a problem with the governor giving McKinsey another contract after their involvement with Purdue Pharma? Oh,
absolutely. I think it's a totally wrong call. There are any number of outfits to do business with if you feel like you need to hire consultants, which, I'm not sure that that's necessary to begin with. But if you're going to hire consultants, don't hire McKinsey.